Halton Hyperbarics reached out to us to ensure the public knows what to do should they suddenly lose hearing in one ear. Nikki Wesley went to find out which steps to take if this happens to you.
I woke up one morning hearing my phone ring, and when I answered the phone I couldn't hear anything on the other side. I was a Navy diver in those years, so I thought possibly water from the previous dive, from the previous day's dive.
After several days with no improvement, a doctor prescribed antibiotics. Daniel was told to return in 6 weeks, but he never followed up.
Between 8 and 12 weeks, there was slight changes in my hearing, and over time my hearing came back, but never to normal.
Sudden sensorineural hearing loss cases are on the rise.
And a lot of people will wait, they'll think, oh, my ear's plugged with wax, or I've got an infection, so they make an appointment with their family doctor, they see them a week later, they put them on antibiotics, or they do something, and, in the meantime, they haven't been getting the proper treatment.
So you're seeing a dozen patients a month with these sudden hearing loss. And if you're talking about a sudden loss of sense, that's a huge deal. So I think that's why it's so important to bring awareness to this condition.
There's probably 5 different things that cause sudden hearing loss. So the first is a viral infection. The second is a disruption in the blood supply to the inner ear. And that can either be because of a clot or something called vasculitis, spasm of the vessels. It can be because there's too much fluid in the inner ear and there's increased pressure. It could also be because there's a benign tumor growing on the nerve. That's a very rare condition.
All of which cause inflammation and swelling. While it's more common in adults 50 or older, it can affect much younger patients.
We just sent Dr. K a patient this morning, a young 22-year-old, previously healthy and just woke up with it. So this is a challenge. It can actually present that way with no warning at all. And of course, sometimes, the more common problem maybe they will have some kind of cold-like symptoms before leading up to it that might clue you in.
Other symptoms can include tinnitus or vertigo. However, if you have a fever, headache, or trouble seeing, head to the emergency room to be checked for infection.
Usually, either they have already been started on some prednisone or oral steroid. The idea is to reduce any inflammation that can help the nerve recover. And that usually takes about a 2-week course. And oftentimes we will suggest to patient to see someone like Dr. K for the hyperbaric oxygen to give them the maximum chance of recovering the nerve.
What hyperbaric oxygen does is it reduces inflammation, it reduces swelling, it provides high levels of oxygen, 10 times higher than what you're breathing now. That high level of oxygen stimulates all that. It improves blood flow and secondarily speeds healing and grows the new blood, helps you grow new blood supply if the blood supply has been damaged.
If the doctor refers you for hyperbaric treatment, it's covered by OHIP. The procedure starts by changing into cotton clothing to prevent static and grabbing a water bottle.
And the reason why is because we have to put the oxygen under increased pressure to get enough molecules of oxygen in the blood to stimulate all those processes I was talking about before. Because of that, you have to equalize the pressure across your eardrums just like you do on an airplane. And most people swallow or chew gum. So we give you a bottle of water to swallow. There's a TV screen outside. They're clear acrylic tubes. So you're going to be able to watch any movie that you like. You just tell the technician what you want to watch, and basically for 90 minutes you can watch a movie. Okay, so it's that simple. It's very, very easy. It's very comfortable. You don't feel anything. It's not painful. And you can drive in and drive out. No issues.
For Halton News, I'm Nikki Wesley.